You do feel, you know, guilt and shame, and by telling your story, you realize that you're not so alone, that there are other people who share similar stories.
I feel more free to speak out, and I feel sometimes I do get those feelings back, so I talk to whoever I need to.
A lot of us are really isolated when you have a mental health issue, or if you're dealing with a substance abuse issue. You don't really have anyone.
I want people to know that they're not alone, so I've always shared my story.
Our stories are unique, but they're also in some ways similar, so you have that empathy for one another, you know? Like, we're all hurting. It doesn't make me or anyone else a bad person. You can rise above what happened to you in the past.
People were being lost in transitions. People were not able to find the right door to get to.
We cover a geographic area that goes from Brighton, Belleville, Kingston, Brockville, and then north to Perth Falls and back across to Bancroft and down. So it's very rural.
Whether you live in Belleville, Brockville, Kingston, we won't have to go to multiple doors to find the right door.
It has been very much collaborative, listening to, consulting with the consumers, the patients, the clients, and their caregivers throughout the whole process.
When I tell my story and they tell yours, then you're like, wow, sometimes you thought you had the bad end and they actually had the bad end.
Listening to me is listening from the heart.
Lack of judgment and openness to hear my story. There's a lot of sort of question and answer, how is this working, how is it not working, which is, it's kind of nice to be part of a new project.
They have a strong voice, and I think now we're going to see it stronger than ever.
It's nice to know people are listening to you and what's needed.
They seem to feel that they're being heard. Their stories are the measure of success.
They gave a strong message to us, and we listened.
Patients told us this is what they wanted to see, and we heard them and we incorporated it into our design.
No one understands any illness more so than people who've had that illness.
Who best to know what we need, what we want?
Right care, right time, right place.
This isn't the end of it. We'll want to keep improving, so we will continue to listen.
I never give up hope. Things can change, and they can change for the better.